environmental health sciences, reproductive and women's health, and environmental justice. She directs the ARISE EJ research group, whose mission is to secure environmental justice and improve health equity through advancements in science, policy, communication, and training the next generation of leaders. Next, we have Dr. Adrienne Hollis. She is an environmental toxicologist and an environmental attorney. She's worked in the environmental justice and public health arena for more than 20 years at the intersection of public health, environmental justice, and climate. She works with environmental justice communities to identify priority health concerns related to climate change and other environmental assaults, and to evaluate climate change and energy policy approaches for their ability to effectively address climate change and benefit underserved communities. We have also Dr. Uloma Uche. She's an environmental health science fellow at the Environmental Working Group. Specifically, Dr. Uche's focuses revolve around drinking water quality, pesticides, non-ionizing electromagnetic frequency radiation. Her educational career began with a BSc in biochemistry that she earned in Nigeria, and then she went on to get her Master's of Public Health in Environmental Occupational Health Sciences and her PhD from University of North Texas. Next is Nsedu Witherspoon. She serves as the Executive Director for the Children's Environmental Health Network, where her responsibilities include successfully organizing, leading, and managing policy, education, training, and science-related programs. For the past 21 years, she served as a key spokesperson for children's vulnerabilities and the need for their protection, conducting presentations and lectures across the country. She's a leader in the field of children's environmental health and serves on the External Science Board for the Environmental Influences on Children's Health Outcomes NIH research work. And then last but not least, Dr. Sara Grineski. She is a professor of sociology and environmental studies at the University of Utah. Her research interests are in environmental health disparities, children's health, and environmental justice. Her doctoral education was funded by a 5-year National Science Foundation IGERT Fellowship in Urban Ecology at the Arizona State University. All right, so first up, after introducing this amazing panel of women speakers today, first I will let Dr. Ami Zota take it away with her slides and her presentation.
Okay. Thank you, everyone, and good afternoon. So pleased to be here with this group of amazing powerhouse women, and during this really, thought-provoking, amazing conference on how do we get to environmental and climate justice. So I'm a population health scientist, and an academic. So I'm going to kind of continue the thread about, how can scientific research help us reach these goals? By pulling in some examples from my own work. So let's see if I can figure out. Okay, so I recently moved to Mailman School of Public Health at Columbia University. And, the overall goal of my research group is to advance EJ and health equity. And I do this kind of in a multi-pronged approach. Scientific research alone is not enough, especially if no one knows about it. So my communication work is really important. And also linking the science to health protective, more just advocacy and policy. And of course, training future leaders. So, this multi-pronged approach is really critical. And why do we need it? Because, this has kind of been talked about at this conference in many ways. And, despite all of the science, all the work we do, racial, ethnic, and socioeconomic inequities in exposures persist in virtually any type of environmental exposure that we know causes harm, right? And air pollution, lead, PCBs, PFAS, higher in some of our indigenous colleagues, especially in the northern regions, phthalates and parabens, flame retardants, right? So these inequities persist. And, they translate into real consequences on health. So I do a lot of work on women's health across the life course, really thinking about intersectionality and the health of women of color. So this is just one of many statistics that you could call up, but especially when we talk about pregnancy related causes Black women are nearly 250% more likely to die than white women from these causes. So, how can the sciences be more effective, right? And so, I think in the academy, we have a lot of emphasis on data. Data alone is not enough. We have to think about the theory and how we're contextualizing the data we collect, how we interpret it. And then importantly, how do we translate that data into action? So a year or two ago, I worked with one of my brilliant, motivated, inspirational trainees. And with the help of Dr. Lisa Bola, came up with something called the Intersectionality Exposome as one kind of way, kind of a new critical framework. So exposome is this idea that, captures the totality of environmental exposures from kind of big, broad factors like neighborhood factors all the way into how they affect things like our epigenome, our proteome, our microbiome. So really the biological consequences of environmental exposures. And then intersectionality, which, maybe many of you are familiar with, this is a critical theoretical framework that really comes out of Black feminist scholarship. Kimberly Crenshaw was really the first to name it, to call it, to define it. And it's really that, kind of getting at the fact that for marginalized communities, systems of power and oppression are not unidimensional, and that they're multiple and intersecting. And so, and that these affect health, and that we need to, these need to be captured in both kind of the way we study harm, but also in the way we think about solutions. And so this is kind of like our sort of, visual representation of where we want environmental health sciences to move. So really capturing multiple intersecting identities, social, structural, political, institutional processes, and understanding how all of those systemic factors are biologically embodied, and really then developing solutions, multi-scalar solutions. So I'm just going to draw one example from my own work. I do a lot of work on the beauty industry and beauty justice, because we know that if you look at it, and my empirical work and that of my colleagues find that Black and Latinx populations use more products, beauty and cosmetic products across multiple categories. So more hair products, skin lightening products, cosmetics, as well as fragrance products, including vaginal deodorants. And, so the research that we do is directly also connected to then, thinking about how are we going to solve this problem, right? And this then informs our research. So you can think about individual educational interventions, policies, right? Because the big elephant in the room is that the chemicals in our products are highly unregulated because we don't have laws that keep us safe. Businesses have a role in especially making sure that there's greater availability of affordable toxic-free products, and then social norms, which I'm going to kind of talk about because, Eurocentric beauty norms is one big factor that drives why, a lot of women of color, communities of color use more toxic products. So we really need change on all of those types of levels. And that's kind of what it can look like in the beauty justice space. So how are we doing that? Well, we do that in deep collaboration with community groups that are grounded in these communities. So my group, works has ongoing community-based projects with We Act for Environmental Justice in Northern Manhattan, as well as Black Women for Wellness in Los Angeles, California. And we design our studies in collaboration with our communities, but we're also using novel tools to ask, further our evidence base. So in the Taking Stock study, we designed a special phone app. We translated the app into English and Spanish. We taught our participants how to use this. They're taking pictures. They're telling us if their fragrances are fragranced. So we have this big database to understand kind of what these communities are using, and to really identify maybe, toxic agents that may be specific to these products. We're getting, higher resolution data on how many products women are using on average daily. And we're also getting information on where they're buying products. And, this is important because market-based initiatives are one way that we can solve this problem. And so Target is a really popular place. In some ways that's good because they've been kind of on board with thinking about chemical policies. 99-cent stores is another place, and they've been, kind of less receptive. So I know a little short. I'm going to try to keep moving, but and we're also looking at kind of who's using this, and we're finding that both race and education matter. And so this is also a way to think about intersectionality, right? So we're thinking about race and class together. So, well, you may now be thinking about, well, why do women of color use more products? And here, I think it's important to really contextualize this in social, economic, and historical processes. And we developed a framework called Environmental Injustice of Beauty because, right, beauty is power. And Eurocentric beauty norms are at the top of this hierarchy, and it's not by accident. It's informed by white supremacy, patriarchy, colonialism. This leads to racialized beauty norms. Women of color are inherently outside of those beauty norms that can often lead to pressures to use certain products, which can impact their chemical exposures and health and disease. So it's important to have these frameworks to kind of contextualize our data. And so I'm just going to keep moving a little bit because I know I'm kind of out of time. But and so this graph, I'm going to keep going because this didn't quite show up. But and so, in addition to characterizing kind of drivers of harm, oh my God, I only have 3 minutes left. Okay, so we are now also designing intervention studies with our community groups. So here we just got funding, the Taking Stock Collaborative, to actually do an intervention study to support Black women in their transitions to natural hair, both with like technical support, but also community support, right? Because both are important, and we're gonna kind of track changes in beauty routines, in product use, in the level of chemicals in their bodies, as well as metabolomics. Just want to say that we're always bringing this data back to conversations with our communities, creating conversations for change. So this is a visual from one such virtual conversation last fall, and that these conversations are important, not just because of disseminating results, but also for, that's how we as scientists learn. I did with Taylor Morton of We Act, we did an event at Pride last year called Toxics Are a Drag. And, they wanted me to kind of help them understand what the research is on toxics and, queer community and sexual and gender minorities. And, really there are huge data gaps because our field has been ignoring these populations. So it's, I always emphasize that it's an opportunity to learn from each other. And then lastly, I do a lot of communications work. I didn't even have a chance to talk about the Agents of Change program, but media is also how we shift norms, because a lot of this work is about shifting mainstream norms on these issues. And one big vehicle for that is media. And so I do a lot of training of, kind of next generation scientists on how to engage with science, with people outside of their silos, outside of academia. And media is one vehicle. And so I'll just end with, like, if you want to hear from next generation scientists really on the forefront of environmental climate justice, check out our Agents of Change program. We are working with these scientists to publish, first person narrative essays. We have a podcast that lifts up their voice. We're getting them in front of videos to talk about their cutting edge research. And so you can find us on Twitter. You can go check out our website. But we would love to hear from you. So I'll end right there. Thank you.
What awesome work. Thank you so much, Ami. This has been, I'm learning so much about your programs, and I'm definitely going to be checking out the Agents of Change website after this. All right, thank you. I know that probably felt like 5 minutes, and I would have loved to hear more, but we are now moving on next to Dr. Adrienne Hollis. And I believe your slide should be coming up pretty soon.
Yes, they should be coming up right about now.
Alrighty.
And so thank you for having me. And I'm going to talk a little bit about environmental justice, stressors, and health disparities and the work that I do. So I'm just going to go on to the next slide. I work on issues at the intersection of environmental justice, environmental racism, public health, and climate change, and on all other issues that affect environmental justice communities. And in that, there are issues that are exacerbated not only by race, but gender. And today I'm going to focus on some stressors faced by EJ communities and with a little additional focus on children. So I often talk about the syndemic or syndemic problems which exist when two or more disparities affect the same population of people at the same time and cause an adverse effect. And so what we've been and continue to learn about is that the syndemic that children and adults, particularly those of color, deal with daily. And I focus on I put mental health at the center because I feel like not enough attention has been provided on the issue. So I'll be talking about structural racism, race and place, and climate change, and how all of those things are interconnected. So environmental racism is nothing new. And to talk about the environment, we have to talk about the role that historic racism has played in society, particularly for people of color, and its connection to where we are today. We have to acknowledge that the underlying factor, which is systemic racism against Black, Brown, and Indigenous people, affects every aspect of our lives, from education to employment, from housing to healthcare, from the food we eat and the water we drink to the air we breathe. And so areas that were later redlined have declined in economic opportunities and growth. And in the past, a literal ring of concrete was poured around some of these neighborhoods. I think some of us can remember that. And environmental racism, in a few words, refers to the fact that controlling for all other factors, race is the single most important determinant of who bears the burden of society's pollution. And this is a picture I took of a neighborhood. This would be a fence line or frontline community that is literally right across the road from a hazardous waste facility, as you see here. And just a little data, populations within half a mile of sites. I wanted you to know that about 27 million people live within half a mile of, for example, a brownfield site. And 9% of that includes children in the US under the age of 5, 8% of all children in the US under 18, 15% of all Black people in the United States, 10% of all Hispanics, and 11% of all minorities. And I think that that's important. If you're talking about within a mile of a site, then we're looking at about 58 million people approximately. And most of those, 19% are children in the US under 5, and 17% of all children in the US under 18 are incorporated, and then 30% of all Black people in the US, 22% of all Hispanics, and 24% of all minorities. So this is a picture from one of my esteemed colleagues from the Union of Concerned Scientists, Dr. Juan de Clet Burrito, and it's entitled "The Inequities of Keeping Cool in Urban Heat Island." It comes from that study, I'm sorry. And he also has the wonderful blog that I really recommend. So when we talk about inner city urban heat islands, typically hotter areas in cities are where most people living with low incomes or people of color reside, typically in older homes that are not energy efficient or that don't circulate air well, with little or no access to an air conditioner or the means to pay for one. And so this is a study of the same, areas in, I think, Arizona. And on the right is a mostly white community, and about 3 miles away, there is a community of color that is, the red denotes how hot. So you see the temperature, and temperature discrepancies in temperatures have been known to be as much as 10 to 20% hotter. And the basic physical mechanism is lack of tree cover. and an abundance of impervious surfaces like concrete that absorb and retain heat, such as and includes asphalt. The social and economic mechanisms that created these deficits were racism and urban development policies that excluded people of color. So a couple of facts. We contribute the least to climate change, we being Black people, people of color. We contribute the least to climate change, yet suffer most from its consequences. And when natural disasters strike, they hit poor communities first and worst. We contribute the least to environmental pollution, yet we have the most exposure to undrinkable water and unbreathable air. In relationship to the built environment, when homes flood, people don't have the money necessarily to remediate and repair, and may end up in situations where they are constantly exposed to mold and mildew, including black mold. And the insurance sector can also play a role here, as people can't get insurance in some cases unless they have their homes lifted 10 feet, for example, a requirement that's not available to people struggling with economic issues, which means that they have little to no insurance. So another health issue that I think is very important and is exacerbated by climate change is asthma. And according to the World Health Organization, more than 200 million people suffered from asthma a couple of years, 2 years ago. That was the data from 2 years ago. And it's a common disease among children. Black Americans are 3 times more likely to die from asthma than white Americans. And that increases to 10 times for African American children. Asthma is more prevalent in communities of color and poorer communities. And of course, one reason for that I've already shown you is the location, right? Where these communities are placed. And it's important to remember that it's not only the children who suffer, but parents also experience the consequences of asthma attack or air pollution, losing work days, often uncompensated, where they must take care of their child and during his or her asthma attack. I remember growing up, my mom, we grew up in a community in Mobile that had to deal with air pollution, and a lot of the parents who couldn't afford medication would hold their children over the bathtub and run the hot water, hoping to open up their airways. And my mom did that for my brother, as a matter of fact. So leading public health organizations, including the American Public Health Association and the Centers for Disease Control and Prevention and the World Health Organization, all consider climate change one of the most significant contemporary threats to public health. Longtime efforts of EJ leaders and scholars document disparate patterns of cumulative environmental exposure and adverse health outcomes by race and income. And those are exacerbated, as I've said, by climate change. We've all heard that climate change is a threat multiplier. It causes increased droughts and flooding and extreme heat. We see all of this occurring now. And this results in human displacement, natural disasters, reduced food and water resources. And I want to add in the syndemic that is climate change. Since the onset of the coronavirus pandemic, the nation's health inequalities have become even more glaring, with millions of Americans of color, Black and Latino in particular, experiencing more severe illness and death due to COVID-19 than the white Americans. So all of those challenges add all of these into the environmental stressors faced by adults and children every day, and you have catastrophic results. Children experience a number of stressors related to the built environment, largely but not totally resulting from their parents' own stress. That includes poverty. There are about 105 girls for every 100 boys living in extreme poverty. It includes jobs and economics and all of the issues that you see listed here. So when we add all of these issues in to the work that we when we're looking at childhood exposures, all of these things affect the child and affect their mental health, their physical well-being, and their level of comfort. And those are things that we need to think about. We need to consider the cumulative effects of all of these environmental stressors. And when we do that, we have to recognize that, yes, children are born whole. They start out whole. But when we consider the impact of all of these things and more challenges, we injure those most important parts of our children. We injure or lose. And so to protect and make our children and our families whole, we need sustainable ways to feed and clothe ourselves. And then we need to eat and drink and to live in safe environments. We need equitable development and infrastructure, safe access to schools and recreational areas, economic improvement. We need to consider that challenges faced by environmental justice communities first, but ultimately all communities stem from a confluence of issues and stressors. Thank you.
Thank you so much, Dr. Hollis. That was a really succinct overview, and it shows us that we have a lot of work to do. The impact of climate change alone is upon us daily. All right. Moving along next. Let me go back to my list. Dr. Uloma Uche, you are up next.
All right, thank you so much for this great opportunity. So for this presentation, I will be, talking to us about my recent work at, Environmental Working Group, on environmental justice in relation to drinking water quality. This work is published in the International Journal of Environmental Research Public Health. Prior to engaging in this project, I never knew the extent of the issues surrounding drinking water quality. So because I came from Nigeria and came here for my master's, then proceeded to my PhD program. So based on research and then working with EWG. So based on research, it's been established, that there are national concerns about drinking water quality and the need for everyone to have good drinking water quality. So with evidence of environmental health disparities among communities in relation to air pollution and other environmental contaminants, just like the previous speakers have highlighted, and also lack of publicly available data about just spatial distribution of drinking water quality. Our focus, for the project was to now develop a framework that considers community level drinking water data and demographic data, an initiative that can be utilized by water and environmental justice research groups. Also, these findings could help, identify communities mostly impacted by worse drinking water quality and support the development of public policies to advance environmental health justice priorities on state and federal levels in the US. Also, the project, the goal of the project was to prove that it was possible, indeed possible for tools like, the EJ screen, which is the EPA's environmental justice mapping and screening tool, to include a drinking water metric, to help examine drinking water disparities that could exist in our communities. So using results of drinking water testing that community water systems conducted from 2014 to 2019, demographic data from the American Community Survey, 5-year estimates for the years 2015 through 2019, and for state-specific case studies, service area boundary data for community water systems, we were able to examine the geospatial distribution of drinking water quality and the population served by community water systems. So on a national scale, our analysis indicated the most common drinking water contaminants in the US to be arsenic, nitrate, radium, and disinfection byproducts. And it is kind of evidence looking at the table that I'm showing us. I know it's a little bit busy, but if you look at the table closely, you see that evident in the number of systems with detections and huge number of people served by those systems. So in examining disparities in drinking water quality, we define drinking water quality in terms of cumulative cancer risks, for water served by community water systems. and examined its relationship with demographic characteristics for the population served by, the water systems we're looking at. So first, our question will be, okay, what is cumulative cancer risk? This is an approach that EWG, Environmental Working Group, pioneered in several peer-reviewed publications, and it tends to like describe the probability of developing cancer over a lifetime exposure to multiple contaminants that may be present in water at specified levels. We all know that we are not exposed to a single contaminant in our drinking water, but multiple contaminants. And evidence shows that these contaminants are, associated with diverse adverse health impacts. So when looking at drinking water quality, it is important, to examine the cumulative impact of, all these contaminants in our drinking water. So just like I said, for this project, we looked at disparities in drinking water quality in terms of cumulative cancer rates, associated with water served by community water systems. So in state specific analyses, California, for this we did for California and Texas, we found that in both states that communities, with greater percentage of Black residents, had worse water quality. And this is kind of confirmed by our previous, speaker. Before going deep into our findings, I know we'll be asking, okay, why look at data from Texas and California? These two states were kind of chosen because of the publicly availability of service area boundaries, data for community water systems in the states, and research indicates that at least a dozen of states in the U.S. have such data, publicly available for usage, but of which, the state of Maryland, is not included. Now, knowing this indicates that, similar analysis like the one we did for Texas and California can be done, for other states. And it also brings to light the need for, states and or federal agencies to regulate the compilation of service area boundary data for community water systems, and to ensure that these data are made available for the public and also for research purposes. So going back to the findings of our analysis, just like I said, we found that in both California and Texas, the communities, with greater percentage of Black residents tends to like have worse water quality. Just to take a minute to explain the figure that we are seeing, the y-axis shows the overall cancer rates from all contaminants, present in the water, while the x-axis shows textiles of communities by the percentage of Black and African American population. And the middle white line in the gray boxes indicate the median cumulative cancer rates. So from this figure, we will see that the highest cumulative cancer rates, is observed in communities with greater percentage of Black African American population, that is the decile 3. We also see that, the cumulative, when looking at the y-axis, you see that the cumulative cancer rates is of several order of magnitude, greater than the EPA's cancer risk level of 1 in a million, suggesting an increased cancer risk among these communities, an urgent need for, policies or initiatives that would reduce, the drinking water contaminations to be enacted. Now, in analysis also, we found out that, communities with greater percentage of Hispanic or Latino residents also have worse water quality. Now, the big question is, okay, what is the implication, for environmental justice policies? Like I said, previous studies have, raised lots of concerns about environmental health injustice, surrounding air pollution and even water, quality. What our study or what our project kind of added was the power of data that was possible with all the information we are able to, collect and compile. So when using this data, it kind of allows us to examine the big picture, what is happening for all the water community systems in a particular state or region or even nationwide. And this type of analysis they're going to share with us is kind of essential, to support environmental justice, excuse me, environmental justice policies, such as, investing in drinking water infrastructure, having a greater focus on helping, historically disadvantaged areas. Now, the big question for some of us will be, okay, what is EWG currently doing about this issue? We at EWG, we are engaging, in this space by submitting comments to the National Environmental Justice Advisory Council, NEJAC, urging them to recommend to the EPA to actually to include drinking water metric in their EJ screen. I think that kind of rounds up what I have. Thank you for the time. I'm happy to take questions from the audience.
Thank you so much, Dr. Uche. This is definitely some interesting work, and we're continuing just to see that there's a huge disparity among the folks who are exposed to these adverse contaminants, and it's in our drinking water too. So thank you for sharing your research with us. And next we'll move on to Nsedu Witherspoon of the Children's Environmental Health Network, who is going to share with us some of her work regarding this topic of environmental justice and health disparities.
Yes, thank you so much. Start the slideshow. Good to see everyone, and thank you so much for my very esteemed friends and colleagues on this panel. It's always an honor to be here, as Omni said, with a esteemed powerhouse of women in particular working so hard to advance our collective health and safety and future. Again, you've heard I'm Nsedu Witherspoon with the Children's Environmental Health Network. We're celebrating 30 years this year. If you don't know, we're a national nonprofit that has always had the same mission and focus. And we're the only organization with our focus in the country, the United States, to protect the developing child from environmental hazards and promote a healthy environment. So we lead what we call the Children's Environmental Health Movement, which has many components, and happy to talk with many of you offline about how we can incorporate the important work that you're doing at community levels and beyond. We're promoting and stimulating and many times, of course, translating preventive research, child protective research into action, translating, educating, training are a big component of our programs and our leadership arenas. And we're working on policies for public health standards and child protective standards. So we're a leader in the climate change nexus between children equity and climate, cancer prevention, air, water, major routes of exposures and why children are more vulnerable to those exposures, which Dr. Hollis mentioned many, childcare, early learning, K through 12 schools, places, homes, places where children spend predominantly most of their time are very critical windows to their exposure pathways. Again, training, really bridging and becoming a mentor for next generation of leaders. We didn't get here overnight, and we're certainly not going to solve all the woes of the rising chronic levels of influence and harm to our generations currently and into the future. So we need a lot of informed workforce to really understand the critical vulnerabilities of children and to advance that learning. We currently are the coordinator for the National Institutes of Health Children's Environmental Health Research Translation Centers. That's a very serious role that we take on. And this is the main way that children's environmental health research, or one of the main ways that children's environmental health research are funded and happen in the United States and have world-renowned attention for the implications from that capacity. So we are a big part of coordinating those centers and helping to translate effectively their findings into action. We're on a variety of advisory committees and leadership positions, and we have state profiles among many resources I want to mention. And one is a new Maryland Children's Environmental Health State Profile. So again, there'll be more of a splash on that soon, but wanted to let you know that it is available on our website. Nelson Mandela has said that there can be no keener revelation of a society's soul than the way in which it treats its children. this, among many of his wonderful mentions, are part of a driving force in my soul for the fact that we can and must do better for current generations and future generations. What the science tells us, and what all of the panelists here have continued to highlight, is that there are a wide variety of exposures for vulnerable populations. Children, of course, I would say at the top of that list, because they don't have the ability, the money, the capacity, the power on their own to change their environments. That comes to us as hopefully responsible adults. But it's not just a one-by-one singular exposure. It's the multiple toxical soup, if you will, that we have to really consider when we're looking at these solutions. This is a very old slide, but sadly the message is all the same, and hopefully will be updated soon by our friends at the Pesticide Action Network. But you know, while we were looking at infectious diseases decades ago, it's the chronic illnesses among our children, as again we've been hearing. And as you see, these arrows are going all the wrong way. They should be going to the left. They should be reducing, incidence and rates, not increasing. And we know that all of these have known science-based components to environmental exposure pathways as well. So when we get into institutional racism, environmental injustice, the Chisholm Legacy Project, Jackie Patterson and myself combined, and I want to thank Adrienne Hollis, also on our panel, for being a wonderful reviewer, supporter, and evaluator, editor of our piece that we recently released called "The Racism That Appends the Cradle," and specifically calling out the direct results of this endemic and how it is impacting Black and Brown children. So legacy impacts of redlining, of disinvestment and rental programs and housing, affordable housing programs, and a wide range of other examples, especially case examples that we give, where unfortunately the burden of climate, the crisis, COVID-19, and also a variety of ways that disinvestment in communities has led to Black and Brown children being continuously well behind the margin of opportunity. So highly encourage you to check that out. And what I do like about it also is that it's a very emotional piece. It was very challenging to be a part of and pull together. And at the same time, we really work hard to pull together existing programs that have evidence-based return on people's lives on a day-to-day basis, so that we are leaving with a sense of solution, partnerships, systemic change, changing the paradigm, and have many places from which we can grow. The climate crisis certainly gets into our realm of children's environmental health. And I would say, and many of us in this field say, that there may be no greater growing threat to the world's children than climate change, and some may differ on that. The way I see it, climate change is the umbrella, and many of the components of exposure pathways that we work so hard on, including chemical exposures overall, are very much a part of that. When we decrease climate indicators and implications, we also decrease air pollution and water pollution and many of the other components that are impacting the health and well-being of our children. There are many things missing, though. I mean, it's not like climate change and children's environmental health are rolling off the tongue of everyone. So urgent, focused attention on the implications to children and those very seamless connections, I believe, should be amplified much more within our fields of work. And I would say there are urgent connections to short and long-term health, right? So many times when people are talking about climate change, it's kind of this long-term. I think we all understand the urgency is now, and there are things that are happening, implications to children, mental health in particular, trauma that are happening to children that have generational impacts, that are happening to women of childbearing age who then carry children that are having generational impacts. And not to mention, women of childbearing age eventually when they choose to have children. There are a variety of inequity realities when it comes to children's exposures to climate specifically, and learning environments, for example. What happens when a major disaster destroys a school in a community, which is a focal point for many things beyond learning for that community? What is the symbolism that shares and passes down to our children? And of course, K through 12, same thing. What COVID has shown us is that when we don't have quality, affordable childcare, and when they're physically not there and able to take in children, that also causes a ripple effect of negativity in a family. So fighting for equity, one way that we're trying to work on the climate crisis is to be part of the solution in what we call the Climate Equity Collaborative. And we're a public-private partnership where we engage non-traditional partners in a very intentional way, and specifically our youth and underserved communities in climate planning and development efforts. So it really is the nexus between children, climate, and equity, which we're excited about. And we're trying to get funding from the for-profit industry, specifically the tech industry. So not necessarily relying on our governments to fund this. Our key priorities are to elevate knowledge and leadership that's already existing within our youth communities, our underserved communities, tools and opportunities, as we've been hearing on this panel, leverage, provide a platform for much more use and utilization and capacity and funding, to provide more engagement and on-ramps for those resources, especially among historically disenfranchised communities, to be driving investments. We want to be part of funding, but also driving investors to these evidence-based solutions that are making a difference but need to be scaled, and elevating children's environmental health and environmental education within the broader climate conversation. So as I talked about childcare real quick, there's this picking up the pieces piece. We did not write this, but one of our partners in the childcare realm did. And it talks about how childcare is fragmented. It's state by state. The childcare policies, funding is very fragmented. It's inequitable, inaccessible, and underfunded. This is broadly. And so the COVID-19 pandemic further exemplified these challenges. And what we know is that this is a field that's predominant by women. And these are small businesses, right? So there's an economic component. They're very much a pillar of their communities in providing critical service. And when you have many of these facilities shutting down, and unfortunately many have not reopened, and you also have many women of childbearing age working and staffing these facilities, these are critical when we talk about environmental exposure pathways. So we have our Eco Healthy Childcare program. That is the only program working to train and educate childcare professionals, owners, facility managers on low to no cost steps they can take to advance safety and protection from environmental hazards in their facilities. Also, again, I want to stress the economic side of this. So lead and many historic legacy issues are still on our docket. We work every day to try to advance understanding of how we can protect children from exposures like lead. And this health economist has stated that, potentially 84 billion a year is saved when we are truly avoiding a lead poisoned child. When you talk about the longevity of the educational component, neurodevelopmental implications, and not including stress to the family. We're also part of the Cancer-Free Economy Network that is working to systemically change the paradigm of how we address cancer in the United States, to not only include treatment and funding for treatment, but also to acknowledge that there are, again, environmental pathways supported by science that are linked to certain forms of cancers, and in our case, certain forms of childhood cancers. What we do know is that childhood cancer incidence has been increasing steadily since 1975, the year I was born. There's never been a dip on that. And so you cannot equate that to genetics. There are other components there in our environment, certain leukemias, brain, central nervous, and lymphomas. So when you superimpose this along with the disparities that we know are happening in fence line and marginalized communities all over our country, it is a total misstep for us as a society to keep and allow these exposures to continue. And finally, I'll just add with an invitation, and I look forward to our discussion in a few moments, but we have this Children's Environmental Movement, and there's Children's Environmental Health Day. That's every second Thursday of October, every month, every year. And we want to partner with you. We want to leverage your work. This is action oriented. We want to showcase what is happening, how you're doing it, what are the challenges you're running into, and how are you overcoming those challenges. It's those type of lessons learned and community spirit that will continue to advance in a much more expeditious way, in a more equitable way, protection of children. Thank you so much. And we have 4 at home among the millions that inspire me every day to get up and do this important work. Thank you so much.
Thank you. Wow, what a presentation. Thank you so much, Nse, because as we know, it all starts with our kids, and there are way too many health disparities still affecting children, disproportionately in the Black and Brown communities. So thank you so much for shedding that light on these issues. And I do see in the comments, someone asked if the slides for the session will be available after the conference. And the answer to that is these recordings will be available forever on YouTube, as long as you go to the Seed YouTube page. So the same place that you're watching these presentations now, you will be able to see these slides and the recordings of the presentations for forever. So All right, and last but not least, Dr. Sara Grineski, and she will be presenting to us on some of her work on Winter Storm Uri in Texas. So take it away. We are having a little bit of difficulty hearing you. We hear sort of like a muffle. At least that's me. I'm not sure if everybody else is having that issue, but it's a little muffled. Maybe we could try again. Oh no, we're still not able to hear you. Okay, we just heard like a loud noise there, so maybe it's coming back. If you have headphones, I know in other sessions they were saying that maybe headphones might help you. Because we definitely want to hear about this work. So I would not want you to not be able to present on this. Oh no, we still are not hearing you. Oh man. Ever so often we're hearing these bursts of sound. So we know that it's not a complete, completely that we can't, that your computer isn't working, but there's probably just something specific with your mic. Eden is asking if you could check your audio and mic settings on StreamYard. So what we can do is maybe start off with some questions while we give Dr. Grinneski some time to maybe try and figure this out, and then we can come back because I know we definitely want to hear about this topic. So if you can hear us, I think we will move on to some questions now, and then maybe come back. You can maybe signal us when you've checked your settings and see if maybe we can hear you again, because I definitely want to hear this topic, and I think everyone listening today also does want to hear about this topic as well. So, all right, so I will begin us off. I mean, first of all, extremely inspiring talks. I mean, I loved everything that I heard. You are really a group of amazing women doing this work, and I'm so honored to be on this panel with you. Everybody is just on fire today. And I also think that I did not introduce myself when I was starting off our session today. So I'm Rianna Murray. I'm at the University of Maryland School of Public Health, and I'm assistant research professor there. So, just backtracking for that for 1 second. All right. So all of you are environmental health professionals, environmental justice professionals working at some intersection of these spaces. One of the significant factors in the current health sector that we have today in our current health system is a lack of environmental justice healthcare professionals, or lack of professionals who focus on environmental justice and bring that to their work in the healthcare field. So what role can environmental justice, health-specific healthcare professionals play in addressing the health disparity gap? Or rather, what role can healthcare professionals who are more trained in EJ work play in addressing the health disparity gap?
Happy to jump in real quick.
Yeah.
Thank you for that. We know that in many cases, not every community, but in many cases, if you poll or you have some community conversations, generally healthcare professionals rank highly when it comes to messaging. Maybe the COVID experience has not, again, instrumented that all the time. It's not across the board, but generally speaking, they are one of many trusted messengers. So it's critical to consider this, and we certainly work with healthcare professionals and have for many decades, but continue to educate, on board, and provide opportunities for healthcare professionals who want to do a bit more to leverage their influence in community. Because unfortunately, there are times when healthcare professionals do not many times understand anything that we're talking about or the basis. And to be fair, environmental justice as a whole, I would say children's environmental health as a whole is not covered on boards,
Right.
or health boards or, other general medical or other health professional training. When you have leaders that are part of those academic programs, yes, they insist and infuse and make sure, but that is a hodgepodge of a strategy. That's not a standard strategy. We want to hone in and take advantage. These are professionals that can be trusted, respected leaders. And of course, when you go to Hill briefings or policy briefings or town halls, to have that MD, that RN, that healthcare, public health professional on, along with, in partnership with community voices, if not already a community member, really goes a long way and continues to add an additional amount of rapport to those conversations. It doesn't have to be exclusively, but can add. And I would also add community partners. So community-based participatory research, the Children's Environmental Health Research Translation program I just talked about at NIH. There are other components here, other programs that, while still working on their effectiveness and validity and all that, are very much holding the banner of what is expected when you're working in community. Sure. Healthcare professionals, scientists, researchers must be working from the beginning, hand in hand with community members and allowing community members to drive. But everyone has their role. And there is a give and take, and there is an educational component on all sides of that partnership. And then finally, as key translators and communicators, so whether it's with media or beyond, helping to advance the learnings, the, calling out the needs at the community level, the injustice needs, to be doing that hand in hand with our healthcare professional community, it has shown to be a great value and can continue to ramp up. And many of the health professional associations out here that are in our space have continued to be leaders in the chemical reduction space and the environmental justice space.
So I think it's also important that you have, when possible, people trust people who look like them. And it's important. I just recently spoke with a woman who was diagnosed with breast cancer recently, and she said there were no Black physicians at this very impressive hospital, and it bothered her. She needed somebody to talk to. And, when we talk about what Nse was saying, I underline everything she says. And then trust and credibility occurs, I think, in conjunction with the ability to see yourself in someone else. Or it's the same thing when I'm dealing with that with my mom and oncologists. It's something about seeing people who look like you telling you information, health information.
I'll just add 2 points. One, just to build off of what Nse said, right? So most clinicians and other health professionals, as they're getting their training, are getting very little formal training on environmental factors, on social factors, on structural factors, and how it affects health. It's, very much a biological model. It's all about pharmaceuticals as the solution. So, I think there's work to be done upstream so that, our health professionals are, adequately trained. And then, I think alliances are really powerful, and I'll just speak to one, and that's the Tender Alliance. So it's targeting environmental neurodevelopmental risk, but it's health professionals, scientists, and children's health advocates. I believe Nse's group is part of it, but it's, this alliance of people that are working on science-based advocacy to really kind of use all the science about how all these air pollution, climate change, environmental chemicals, how they affect the developing brain, to really kind of push for science-based health protective policies. And it's, these alliances are just really, really powerful, because I think these problems are so big. They're bigger than, they're too big to be solved by just one individual, one organization. The other thing I just want to add to this conversation, I didn't really get to speak to it, but I do a lot of work on uterine fibroids, pregnancy health, kind of women's health, and using kind of qualitative interviews in the fibroid space. We have found that, like, when you talk to women about, like, what are the factors that inform their decision making around their health issues, right? It is some things like patient interaction, but it's also historical things like medical exploitation, especially in the gynecological space, with Black women. And so, thinking about how to train clinicians on these structural factors, I think it is key too. And there's this movement called structural competency that's coming out of Vanderbilt, that's really trying to kind of both put the emphasis on there's a lot more going on in a clinical setting that goes way beyond just the patient clinician interaction. That's going to really affect how information is received, kind of what decisions are made. And so to kind of train clinicians on that, and also to, not just think about pharmaceuticals as, the only way to solve a problem. Sometimes it's about affordable housing, right? Or getting someone some kind of housing, or, access to, to healthy food. So I'll just end there. Thank you.
Yeah, I just want to jump in with just to agree to what we all said. So I believe that, our healthcare professionals do not have the adequate training, so the thing that we need to do just to ensure that academic institutions, create, environmental justice curriculum from, coursework to departmental measures, and also to engage, the EJ community members, directly in that work, by sharing what they've already put together as their institutional resources. Because when we have these EJ healthcare professionals, I believe their presence in the healthcare system will initiate, positive change in how care is being provided, to these underserved communities. I believe they will be able to advocate for accessible, affordable care. They'll be able to the members of this community will be able to benefit from this care that they provide, and reducing the current rate of illnesses that have been associated with this group of persons.
Yeah, I mean, you all raised amazing points, because, it's like I've told my students before, you can treat someone for asthma with drugs or with a nebulizer or whatever, and then you send them home to a house that has mold or roaches, or to a community where they can't, there's polluted air, or they can't access their healthy foods because they live in a community where there's only corner stores. So it takes this whole system change, right? And when you have healthcare providers who aren't aware of that, then they're just pushing the drugs, and they're, just making pharmaceutical companies rich. We just have this cycle that is continuing. So anyway, I could talk forever. All right. Dr. Grinneski, should we see if perhaps your slides and your mic and everything is back on now? Oh no, we're still having some issues. You said you were going to try Google Chrome.
Can you hear me?
Yeah.
Oh, okay. Now, yes.
You can hear me now. So.
Yes.
You can. Okay. Yeah, it said in the mic check that my mic was working now.
Oh no.
I'm sorry to interrupt the Q&A. Yeah. Okay.
That is okay. That is not your fault whatsoever. So I would love for you to give your talk, because I think we're all interested in this, and we can always circle back around to the Q&A after. So go right ahead.
Yeah, we should still have some time left, since it's 10 to 12 minutes. So what I had started to say before was that I'm really excited and honored to be here with all of you today. I have a whole list of things to check out after the talk, things I've learned and want to look into more. So it's interesting how our talks are all sort of complementing each other without overlapping. I'm going to talk today about some recent work we've done on the winter storm Uri in Texas that connects with these themes of environmental injustice and health inequities. The work is collaborative with Drs. Tim Collins and Jay Chakraborty, graduate students Eric Goodwin and Jacob Aoun, and undergraduate student Kevin Ramos. So Winter Storm Uri, in case you're not familiar, happened back in February of 2021. It was 3 Arctic fronts that swept across Texas, resulting in winter, very wintry weather conditions, even in places where usually it's not so cold and snowy. At least 111 people died. There was $130 billion in losses in Texas, and 10 million people went without electricity for a period of time. And this picture here is Houston, right, in February, just to give you some reference. So one of the things we're thinking about in our project is Uri as a cascading disaster, and how this whole idea of cascading disasters connects with environmental justice and health inequities. So cascading disasters are these extreme events in which the environmental hazards, the social vulnerabilities, and the infrastructure systems intersect to generate unexpected secondary events. And another paper looking at COVID added this idea that sometimes there could just be multiple unrelated disasters happening in the same place, and that those can cascade too. And we're thinking about that with Uri as well as COVID, right? And how they're sort of unrelated, but they cascade together to shape impacts. So we see Uri as a cascading disaster because these really cold temperatures caused power and water service outages. Freezing damages to pipes caused the pipes to burst, and then people had to wait a very long time for those pipes to repair because the plumbing workforce in Texas was overwhelmed, which then had secondary impacts. And then there's all the things with COVID. 400,000 doses of the vaccine were delayed in Texas because of the storm. So we see Uri as a cascading disaster. Power and water outages, which are a focus of my talk today, were a very important cascade that happened in this event. According to a University of Houston report, 69% of Texans went without power and 49% went without running water at some point during the storm. And as we think about health, right, both power outages and water outages have health impacts. Gastrointestinal illnesses are at the top of the list for both, but there's other sorts of health impacts as well. And when we think about power outages, those relying on electricity-dependent medical equipment can be particularly vulnerable to health problems during sustained power outages. So linking these things together, right, we see that cascading disasters can cause or expose social inequalities and disaster impacts that reflect environmental injustices. While work on the connection between adverse health impacts, health inequities, and cascading disasters, that work itself is still nascent, right? People are sort of starting to work in this area. But it's really important as we think about cascading disasters that we make the link to health inequities, which are disparities in health that are unnecessary and avoidable in addition to being unfair and unjust. So we have this whole cascading disasters, health inequities, EJ framework, and then we're also interested in the mental health effects. And as we think about climate change, we think about more frequent extreme events. Cold weather events can also tie in to that, right? And there's been less research on cold weather events than warm weather events. And it's interesting because the global burden of disease study shows that cold attributable mortality exceeded heat attributable mortality worldwide. So we tend to think a lot about heat waves and climate change, but it's important to recognize that cold weather events are also important. And then to make the link that they may indeed also be related to mental health. And that's what we're looking at here in our project. So we conducted a survey, a 35-minute telephone survey of randomly selected residents in 8 Texas metro areas, which you can see there on the map. And we got actually exactly 896 respondents to take our survey. And we collected these data 5 months after the event. And so the presentation today for the next few minutes sort of brings together 2 in-review papers that we have. The first asks about sociodemographic disparities in duration of basic service outages. So were there race and class-based disparities in the duration of power and water outages? And then the second paper looks specifically at post-traumatic stress, both social inequities in the risk of this, as well as how power and water outages and COVID-19 shaped the risks of post-traumatic stress after URI. So in terms of this first question about social disparities in duration of outages, we found really large disparities. And these are multivariable models. They control for a host of things, including income, nativity, age, disability, housing tenure, whether the household was on the ERCOT grid, which was the one that had the big failure or not, and then how serious the event was based on temperature in that place. So we found then in these multivariable models that Black householders had on average 53.2 hours of power outages compared to 36 hours for non-Hispanic white householders. For households with children, we also found a significant disparity. They had longer power outages than households without, about 47 hours versus 34 hours. And then we found a disparity as well for renters versus owners, with about 43 hours for renters and 38 hours for homeowners. Then for water outages, there was one significant finding, and it was that Black households had longer hours than white households, specifically 52 hours versus 34 hours. So these, in my opinion, are really meaningful differences. If I try to imagine, managing my household without power for these lengths of time, well, certainly it's long for everyone. It's significantly longer for households, specifically Black households, households with children, and renting households for the power outage findings. And these, if you're a statistical person, are estimated marginal means. So as we think about what does this mean, I looked at what are the requirements. What does the CDC recommend if you have a power outage? And they say that the refrigerator food is only safe for up to 4 hours, but that a full freezer could last up to 2 days during a power outage, 1 day if it's half full. So we can think about these benchmarks, and then we can look at these findings, and we can see that Black households outages exceeded this 2-day window, while the white households did not. The same was found for the households with children. And then the renters' households, theirs exceeded the 24-hour, but not the 48-hour window. So it seems like these are meaningful differences that we've uncovered. The risks for this, right? We already talked about gastrointestinal illnesses, but also you can imagine, the stress as you can't flush your toilet, you can't turn on your lights. There's economic costs with buying all the food to replace your refrigerator. And then there was problems in Texas with finding and accessing bottled water and being able to buy that as well. So these are these sort of disparities here in this first paper. Moving along, for the sake of time, the second paper, if you recall, focuses on post-traumatic stress. We found that 18% of householders met the criteria for potential post-traumatic stress disorder. And there's really very little research on cold weather events and post-traumatic stress. And so we don't have a direct comparison, but it's really interesting that in our work in Houston after Hurricane Harvey, we found a similar 18% of folks suffering from probable or potential post-traumatic stress based on this PCL standardized scale. Then we find pretty dramatic inequities with regard to race, ethnicity, and odds of meeting this sort of PTS cutoff. Black householders were 6.35 times more likely to have this PTS flag than white householders. We found disparities for Hispanic householders as well, with their odds being 3 times that of white householders. We also found risks for householders who had a disabled family member. And there's very little research on disability and post-traumatic stress after disasters. The research out there tends to look more at, if you lost a limb in a disaster and developed post-traumatic stress, but not just sort of PTS without sort of dramatic injury. So that's clearly an area where more research is needed. We also found that if you were in HUD-assisted housing, you had a higher odds of PTS than those who lived in an owned home. So then we looked at the issue of outages, right? And we found that having a piped water outage during URI increased your odds of post-traumatic stress by 81%. And we had power outages in the model too. That one wasn't significant, although it was positive. We think this may be because water outages were longer. They were also less frequently. So with statistics, it's easier to find it, right? When everyone has a power outage or 75% have power outages, it's harder to detect an effect. But we did see that this piped water outage was associated with post-traumatic stress. And then we are interested in how COVID intersects. And we found that if you were highly impacted by COVID, that means that COVID-19 had affected at least 5 areas of your life, including, your employment, your finances, your social life, your health. We asked a variety of questions. And that had a pretty significant and large effect on if you had storm-related post-traumatic stress. So we're specifically looking at winter storm-related post-traumatic stress, but we see that COVID happening in your life made you more vulnerable to this storm-related post-traumatic stress. So to conclude here, my little talk today, we found dramatic race-based environmental injustices in power and water outage durations and in the odds of storm-related post-traumatic stress. As I sort of reflect on the body of work that I've been working on all summer, I really think that's the most significant and important finding that emerges. Clearly, we need to improve infrastructure systems to withstand extreme weather, and to do this in such a way that it provides equitable protection to all communities and doesn't just, reinforce the advantages that white communities already face. Then we can think about why this is. I mean, certainly there are inequities in the experience of, disasters like Uri, but there's also underlying inequities that are unrelated to climate change, such as systematic disinvestment in access to quality housing, education, food, infrastructure that need to be addressed as well. And then the mental health support clearly is important, as we have Black and Hispanic residents experiencing significantly and dramatically higher incidence of this post-traumatic stress after the event. And then as we think about disaster planning, we clearly see, and I didn't present all the models, but some of the results really illustrate how the experience of being highly impacted by COVID-19 had a dramatic impact on the post-traumatic stress after Uri. So as we think about disaster response during the pandemic and in these sort of years to come where we chronically have to deal with COVID-19, it clearly has to be part of the disaster response, because it's a huge sort of underlying issue that is affecting communities. So that is what I had prepared for you today.
Thank you so much. I'm so glad that we were able to get that sorted out so we could hear about this work, because it's extremely impactful to just see these numbers, and I'm really glad that you did this work and that you were able to tell us about it. So I'm going to pivot back to our Q&A session, but I do see that there was one comment from a participant who's watching us on YouTube who asked specifically for Dr. Zota, do you have environmental injustice beauty materials for teens?
Yeah, thank you. Thank you for that question. We are actively working on it. So we will be, as I was sort of alluding to, I think research, translation, science communication is so key. And so we will be actually developing those this fall. And so I would be happy to stay in touch so that, we can get you those materials as we're developing them, and maybe even get people's feedback on them. And we'll be doing this in collaboration with our community partners. Yeah.
Awesome. Great. So please stay in touch to be able to get some more info on those materials in the fall. All right. So I know we're running short on time. So I had like 10 questions, but I think I'll just ask one more. All right. So a lot of you on the panel here today of amazing women have been involved in work that's reflecting on environmental hazards and exposures that overlap with health. Today I heard a lot about risk and cumulative risk, and I think even someone used the term multiple toxic soup, which I wrote down because I thought it was such a great term. But basically what I'm trying to say is that we have, we're looking at all these overlapping and intersecting risks and factors that are contributing to poor health and adverse risks and adverse health. So we've also seen in the past few years that the COVID-19 pandemic has just shed such a light on how health disparities intersect into areas like housing, job security, and infrastructure. So given your different backgrounds, how has COVID-19 sort of impacted your understanding of health disparities and environmental equity? And it's a two-part question. So where do you foresee us emerging or going in the future as a result of the pandemic in terms of policies and initiatives to mitigate these different health disparities?
I'll jump in first since I have to.
Yes, leave. I was actually going to say something.
One of the main things for me that the pandemic has uncovered is the lack of data, is race-based and place-based data, and how important that would have been had we had it in terms of treatment, vaccine distribution, and other protective methods. And I think what we need from this, what we need is policy that requires the release of that sort of data, of demographic information, right? Because we need to know populations that, for whatever reason, are more at risk from opportunistic infections like this because they have pre-existing conditions. We know that inherently, but we need that data to be released in a transparent manner. Thank you for the question.
Thank you for your response, and thank you so much for being on the panel. I know you have to pop off, but it was a pleasure having you.
Please.
Yes, please do.
Okay, so yeah, I was gonna say something. I kind of agree with what she said. So for me, I think the COVID-19, the whole pandemic thing has actually widened up the health disparities because, pre-COVID, we already see higher rates of, chronic illnesses, associated with people of color, marginalized population. And during this pandemic, we also see the same thing happening whereby this set of people tends to have increased risks of exposures to the virus because of their living conditions, their working conditions, and also subsequently we see them having higher incidences of COVID, like illnesses and deaths, associated with COVID. So for me, I think with what is going on with the pandemic, I see we are going to start prioritizing equity because we already know that this marginalized population do not necessarily have access to, healthcare, equal treatment, and all these things. So with this pandemic ongoing, we see that we're going to start prioritizing, equity in healthcare, just to reduce the impact, not just on this population, but on the country as a whole. And also I see, just like Adrienne said, that we also see the fact that we do not have a lot of health data on board. So with this whole thing happening, we're going to see us having this data available, and we tracking this health data, making sure that it is accessible for research purposes, which will also inform, when we analyze the data, it will also inform policy changes, that will protect this vulnerable population.
Thank you so much. Yes, data. It's
I'll just jump in here. I think a couple of points. I mean, one, just from a health research perspective, so many people have had COVID. We have to think about the ramifications of long COVID across the board. Because we need to study it more, but just the number of people who will have long COVID is really daunting. I think another thing to think about is the integral role of social sciences. I am kind of grounded more in quantitative sciences, but I mean, with COVID, we had a pretty good vaccine, which is in some ways was a biomedical, discovery miracle, but we didn't have very good uptake of that vaccine. And it's because, we overemphasized kind of the discovery of it, and, kind of didn't think through the kind of social dynamics of building trust, of addressing people's concerns, of meeting them where they're at, all these things. So I think that's, hopefully it should be a lesson learned about the types of information and science that are needed and valued. And then I think the other thing, as an academic, as someone who teaches the next generation, I mean, I think there has been this increasing mistrust of institutions, of government, of science, of medicine, which it impacts what I do, because if I can generate new insights, new knowledge, but if people don't inherently believe in these institutions, then the value of all of our work is threatened. So I think the rise of misinformation, the distrust in institutions writ large is is really concerning. And I think it's something that we all need to be engaged in.
Yeah, and I know, sorry, and I know we got to wrap up. This is not going to be our only pandemic, right? It hasn't been and it will not be. So it is so essential that we take the many lessons learned and get serious, because life does need to continue in some way, shape, or form. I don't think any of us want to go back to where we were almost 2 years ago. So when I think about where kids spend a lot of time, the home environment can be kind of overseen by parents, caretakers. School environments, early learning environments, much different. You're relying on other people to, in theory, do the right thing. And in what we've seen, and I think what blew our socks off in public health that we might not have expected, was how politicized wearing a mask became, how detrimental it became to become a public health liaison, communicator, health professional, going to school board meetings and then being attacked, threatened. The fact that that became an okay circumstance in certain parts of the country is totally not okay, right? The fact that certain perspectives won out over public health, solid science, and evidence. What we do know is that masks work. What we do know is that the vaccine worked. What we also know is that the longer that we have these strands and new strands, there's other challenges. These are things that were called out from the very beginning. So I guess I'm also like a broken record. The communication of accurate, easy to understand directives, which I think all of us wish we had, right, consistently throughout. And I would also just make a plea for our K through 12 schools, our early learning childcare professionals, because a lot of them were looking, seeking, searching. And especially when more and more families, when schools were open this last year, were dealing with COVID, those folks at the front desk were just not able, equipped, educated, supported in giving the accurate information that the health department might have had. So it's many layers of this, and I'm not blaming any particular person there. They're doing the best they can, but the array of information that people are getting also adds to the dismay of it, and just kind of throwing your hands up and just kind of doing what you think you can do. So there's a lot more we can do, especially in our marginalized communities. And I'll just add occupational settings. A lot of the occupational settings that we know, if you're a frontline worker, you're i.e. an essential worker, many folks did not get the luxury of work from home, as I have and still get to do periodically. So what are we doing with those employers to not only protect them from their work hazard potential, but also the components of high risk, like a worldwide pandemic? At the end of the day, everyone wins when people are healthy, can go work, when people can go to school, when teachers can teach in a school set, like all the wins there versus all the negative repercussions. I don't think any of us want to go down that route unexpectedly again.
Right. So true. Such very valid points. Thank you so much to this amazing panel. And I just want to end us off here with asking each of you for just one sentence takeaway. Just what would you like to leave our audience with? I saw that we have about 56 people watching. So what would you like to leave these 56 folks with today, your takeaway message? And anyone can start.
Our children are our future. I mean, there are songs about this and whatnot, but it's so true. What we hand off to our children, the good, the bad, and the ugly, is sustained by the next generation and the generation after them. So, putting a lens of child protective considerations into all that we do, I would advise will gain us huge returns compared to where we're at.
Thank you so much, Anse.
I'll add, if you have the privilege to vote, it's really important that we vote so that we can elect officials with, health protective and environmental health and environmental justice policy in mind.
Thank you.
And I can jump in. We know that health disparities, have been documented for decades, and it kind of reflects the long-standing structural and systemic inequities. I know that has been rooted in racism and discrimination. So I believe we need to start tackling the root cause of these issues that we're facing, to protect the vulnerable population, which includes the people of color, the low income, the marginalized population.
Thank you.
Yeah, I would just add to this, we have a lot of evidence around exposure disparities and characterizing harm. We need to move towards solutions, right? Solutions-based science, and that these problems are so big that they're not going to be fixed, you know, by any of us alone, right? So these alliances are important, training the next generation, and, you know, really supporting community-led, you know, structural change, I think is how we're going to get there, right? So we really need structural change, which is, you know, a long, hard fight, but I think we each have a unique role in it.
Thank you. All right. Thank you so much to all of you for joining us today on this panel. I must say that this was a very inspiring and very informative panel of folks, and I think everybody watching will agree with me. And thank you everybody who tuned in to this panel to watch us today and for joining the Siege Symposium overall. And I will see many of you in some other sessions for the rest of today and tomorrow. So thank you all and have a great weekend.
Thank you, Rianna, for
You're welcome.
moderating.
Thank you all so much.